Welcome everyone to the Careers Team Industry Insight series. So my name's Lindsay McMahon and I'm a project officer within the Careers Team, and we run these sessions to give students an opportunity to engage with industry, find out more about employer expectations and opportunities. And we're delighted to welcome Public Health Scotland to this afternoon's session. So we have Kyra Gribben and Caroline Crocker from Public Health Scotland, who's going to discuss opportunities within their organisation, the recruitment process, and what it's like to be a graduate within the organisation. So I'll hand you over to Kyra and Caroline.
Thank you. So I'm about to say morning everyone, but it's not, it's now afternoon. So hi everyone, I'm Caroline Crocker. My role is People Development Manager at Public Health Scotland. So what I planned to do for you this afternoon was just give you an overview of who we are as an organisation, to help you understand the work we do, the priorities that we've got. And then I'll hand over to Kyra and she'll talk you through what it's like to work as an analyst role. And Kyra will give you a bit of a background to her career pathway into our organisation and the types of work that she's done since she arrived. So I'll share my presentation now. If you've got questions, pop them in the chat box as we go along. And if I see anything coming up that's relating to what I'm talking about, I'll stop and try and answer that for you. If not, then there's time at the end and we'll take any questions that you're interested in finding out that we maybe haven't covered as we've talked. So. Okay, does that come up all right and you've got it in Screenshare?
Yes, we can see that fine.
Perfect, okay. So, Public Health Scotland. We're a fairly new organisation. We launched on the 1st of April 2020, last year, and we didn't launch because of the COVID pandemic, but we have been significantly involved with that work ever since we started. We have been planning to open Public Health Scotland for a number of years, and the reason behind that was to tackle some of the really challenging issues we've got in Scotland today around public health. So we have a really ambitious vision for our organisation, and that's to create a Scotland where everybody thrives. And we're quite a unique organisation. We're formed as part of the NHS, but we actually have a dual role where we report into Scottish Government, but also COSLA, which is the Consortium of Scottish Local Authorities. And that basically means that we have a national remit, but we also have a really local remit, and we work very, very closely with local authorities to tackle the issues that they're facing. And this next slide just hopefully gives you an indication of some of the key challenges that we really face in Scotland. So this map on our left-hand side shows us the life expectancy of the people of Scotland. And you can see there we're sat at 79 years. And if you compare that to the rest of Western Europe, you can see there that we're trailing behind. We are the lowest life expectancy across Europe and have been for a significant number of years. And that's troubling. And to change something so significant as life expectancy, it takes a lot of work and a lot of change. So that's one thing that is guiding us why we needed to change and introduce Public Health Scotland as a new organisation. The other challenges in this sort of diagram on the right-hand side shows the types of problems that we've also got in Scotland, which illustrates the differences in inequalities and health inequalities that we tackle. And if you look at this map of Glasgow, I'm sure you're familiar with it as you look at the sort of metro line, and you can see here the differences just one city has in terms of life expectancies from its east end, which is a sort of more deprived area, travel probably 10 minutes on a metro line up to a more affluent area, and life expectancy changes significantly. And there is also a difference between males and females. So I don't need to read those figures out for you to see the impact that they've got. But these are really big challenges that we're facing every single day. And because of that, Scotland before had no one organisation that led the way in terms of tackling public health issues. And that's why Public Health Scotland was set up. So in terms of how we operate as an organisation, because to tackle some of these things I'm talking about, you do not do alone. You have to work in a really collaborative way. So we've been set up and we have such a broad range of people we work with. So this sort of circle on the left shows the variety of our stakeholders that we work very, very closely with. So we work really closely with the NHS and the health boards. We work very, very closely with local governments and local authorities. We work with community planning. We work closely with academia and helping us with research and projects. We work with businesses. So Scottish Water is one of the organisations we would work really closely with. We were the first in the UK to be doing COVID testing of our water supplies to see if there was any impact going on there. So wherever we need to, we partner with the right organisations to do the right types of work. We work with charities, third sector. We work very, very closely across the health and social care sectors. We work with national government. So Scottish Government is a key stakeholder for us. And the ultimate aim is to improve lives in communities, but also of individuals. And when we think about public health, we don't just think about our acute health services, which is where the health boards focus. Public health looks at issues that span a much broader range of topic areas. So we look at the impact of food and nutrition and what people eat to give them a healthy lifestyle. We look at their education and the basis that gives them for the life that they will lead. We look at things like water and sanitation. We look at the quality of their housing and the places and the communities that they live in and the impact those have on their well-being and their lifestyle choices. We work very closely with health and social care services so that work overlaps very, very closely and those people that find themselves within the care services. We work with employment agencies and we really try to help employability of different communities so that we know if people are in work and are earning money and are creating a more stable lifestyle for themselves and their families, then this will have a positive impact on their health and well-being, and therefore a positive and more preventative approach for the services and the systems that we need to manage. So all of these things are interlinked, and that's why public health is really exciting to work in, because there's so many different dimensions to it. In terms of our priorities as an organisation, there's so many areas that we touch on, but we had to narrow it down. So if you were to ask us or look on our strategy document, which is all on our website, you would find that the 4 key headlines of what we work on is COVID. And that's absolutely obvious right now why we're working on COVID. It's affecting all of our lives, but it is pivotal to what we're doing now with the data that we're collecting, the advice that we can give, showing the trends that data is what's happening. So that is a key part of our work. We're in the middle of the pandemic now, but the work will continue once the pandemic is over. because COVID has left an impact across society, and especially our more deprived areas. So the work will continue for many years ahead for the recovery from COVID. We've got to tackle mental health challenges in Scotland. So mental well-being is one of our priorities. We want to tackle inequalities to do with where people live and their communities. So lots of work goes on under the umbrella of community in place. This goes as far as things like climate change. So we were heavily involved with COP26. But it also goes down to things like green space, your housing, your access to playgrounds and things for children. All of those things are part of the communities we live in. And our fourth priority is poverty and children. Because what we know is if we can tackle things at the early stages of people's lives, if we can improve people's life in their early childhood, we can hopefully set them on a path for a better future. So therefore, if we can look at the issues facing children and lift them out of poverty, then that will certainly help long-term challenges ahead. So this just shows you some of the work that we do. And this is linked to the work Kyra will describe in terms of our data and analytics. So lots and lots of the graduates that come and work for us often work in teams that analyze data. And this just shows how we take data and produce it into dashboards for our stakeholders, but also for general citizens. We've got a COVID dashboard that has had over 40 million hits now. Now that's unheard of. We'd be lucky if we got 50 hits on a publication we put out on a website before COVID. So 40 million is pretty impressive. But we're hitting audiences now who are interested in our statistics, more so than we ever have. There are people that go on to our website that never ever were interested in health statistics before, but because of COVID, they are. So our data is incredibly important, not only for citizens, but it has played a pivotal role for Scottish Government in the decision making. Every single day, we know the First Minister looks at our figures to guide her in the decisions she has to make. And that's part of the work that our teams are doing on a daily basis, 7 days a week, and have been since the pandemic started. Oh, lost my button to move forward. The other absolutely critical area of our work right now is the vaccination programme. We know vaccinations are our defence against COVID. It's our way out of this pandemic. So our teams record vaccination uptakes. We look at any issues that may come through about taking the vaccine, but it's an absolutely critical part of our role around the COVID work. And this is some of the examples of the other pieces of work we're doing. So we'll do survey work. We'll look and try and see what the issues are. So this was an example of a survey that was done into early years, resilience and impact. So it was looking at different households with children and the impact that COVID had had on them, and looking at what those surveys are telling us and what changes and impact that we need to tackle. So I'm going to pass over now to Kyra, and Kyra will explain what it's been like to work in Public Health Scotland as a graduate a few years ago, and how her career has moved on since she joined us. Thanks, Kyra. Do you want to just give me a nod each time you want the slide to move forward?
Yeah, that's great. Thanks, Caroline. Yep, so I'm Kyra Gribbin. I'm a Senior Information Analyst at Public Health Scotland. I've worked here since I graduated in July 2016, and I've moved through a few different teams in that time, so hopefully I can give you a bit of an overview of what it's like to work here. Yep, just next slide, please. So this is just my career path. I studied maths initially at Glasgow Uni. Realised pretty quickly that it wasn't really for me. My only real reason for picking it was I liked maths at school. And then I got to second year maths, and it was very proof heavy, very theoretical. And at one point, one of the lecturers said that in third year we would get to prove that numbers were real. And I was not on board with that. I wanted to do something a bit more of a practical application. So I swapped over to statistics. They also, in my opinion, offered better degree programs, including the MSci work placement program, which is the one I ended up doing. So with that program, it was an undergraduate master's, and it involved that instead of my fourth year being at uni, I would go out and work somewhere for a year. It would be an assessed year. I would have to complete a project, and then I would come back and do my final year at a master's level, so like a bit of additional work for all the modules I had to do. So in 2014, I did my placement, and I was placed in what was then ISD, which is now a part of Public Health Scotland, and I worked in the GP out of hours team. I don't know if, I'm sure most of you know what GP out of hours is, but if you don't, it's the service that replaces GP practices, evenings, weekends, public holidays. Anytime the GP isn't open, you can be referred to GP out of hours for things that need to be seen quickly, but they're not actually life-threatening. So I really enjoyed that year. It was great. It was just really beneficial to work in an office environment and see what that was like, almost like as a trial run before graduating for real. So I then went back to uni, finished off my degree, and I graduated in 2016, like I said, and I returned to what was then ISD as an information analyst in the secondary care team. Secondary care, it's everything to do with hospitals really, inpatients, outpatients, beds. So quite an important team, always lots of work going on, always lots of attention being paid by the government to how many beds there are and how many patients are in those beds, and are there enough beds, are they in the right areas. So it was quite an intense team, but I learned a lot. And by 2017, I felt ready to apply for promotion, so I did, and I was promoted to senior information analyst, which is my role now. And I worked in the mental health team. That was a completely different experience to my other teams. Again, it was quite a hot topic, still is, always lots of attention being paid to mental health. So it was a really interesting team to work in. There was just such a huge variety of work, and it involved a lot more working with external people than I'd done previously. So Caroline had mentioned we work collaboratively with a lot of other organisations, and that was true in mental health. We worked with the Samaritans, with the Scottish Government, with Police Scotland, with various health boards, all coming together to try and have a single approach to mental health. So I did a few years there, and in 2019 I joined my current team, which is Transforming Publishing. Doesn't really tell you a lot about what I do from that title. If I had to sum it up, our main aim is to transform the way Public Health Scotland publish their information. For a very long time, Public Health Scotland would publish a PDF report up to sort of 80 pages and a whole bunch of Excel tables that each had a whole load of sheets in them and lots of tables. And it was all very static, and it was quite hard to find the information you need, and we're trying to step away from that. Although I have to say recently we've not done a lot of that. A lot of the workforce has been redirected to COVID, including me. So just next slide, please, Caroline. There we go. So I was just trying to summarise the three main things that I have worked on and do work on. Obviously, as an analyst, a huge part of my work is doing analysis. There's a range of analytical tools we would use for that. SPSS has been the tool of choice for a long time in formerly ISD, now PHS, but it is being phased out now. As of 2023, we won't have that anymore, so we need to start looking for a replacement, and that replacement is RStudio. I don't know if any of you would have used that or heard of it. It's a statistical tool mainly. It's very heavily used in statistics, heavily used in psychology, but it's useful for a whole lot of things: data analysis, visualization, making dashboards. Another huge part of analyst work in previous roles, maybe not in my current role, are what's called IRs, PQs, and FOIs. So that's information requests, and they can come from anyone. Just anyone off the street can write in and ask us a question, and we need to go and find the data to answer that if we can. Parliamentary questions, obviously they come from the government and are quite often brought up in sort of First Minister's questions. So they tend to be on kind of the topic of the day. So if something happens, there'll suddenly be an influx of parliamentary questions asking about it. Freedom of information requests are very similar to information requests, but there's just a more formal route to answer them, but anyone can ask one of those. I also have worked on publications, so I mentioned that we usually publish reports in Excel tables. There's quite a lot of work goes into those and getting those out, and depending on the team, it can be weekly or it can be annually, and it totally depends on the team you're in, how much work that takes. But there's also ad hoc requests that might come in from others in the organisation. So we have some consultants in public health medicine who work in the organisation, and they each have like their own research area, and they might reach out to a team and ask for some information to help support their work. More recently, a lot of COVID-19 work, and I do talk about this in a few slides, I'll cover it then, but obviously being a public health organisation, we had to just react really quickly to get the data out there that was needed for the government and for the public. I think COVID has forced us to work a lot more flexibly and a lot more reactively than we did before. I think previously, if someone wanted some information, we'd be like, yeah, that's fine, and we'd work on it. It would take us ages. We can't do that now. Policies are changing sometimes overnight, and we have to be on top of that. I also worked in COP26, which Caroline mentioned. That was really interesting. I was involved in a team that was trying to monitor any potential outbreaks. I'm sure you all heard there was a lot of worry about whether COP was going to cause an outbreak of COVID and would it put Glasgow back into some kind of restrictions. Didn't happen, thankfully, but we were monitoring it. And it wasn't just COVID, we were monitoring it with stuff like norovirus, which is a pretty horrible stomach bug. If any of you ever had it, you'll know how horrible it is. Also working on RAP, which I promise is not what you think it is. It stands for reproducible analytical pipelines. A lot of our work to create publications is very manual. You get your data out, you copy and paste it into Excel, and then you write the report. There's just 1,000 chances to mistype one number. And if that one number is a really important number that the government rely on, that's going to be a problem. So it's trying to automate the publication process as much as possible so that there's less chance of error being made. I've also been involved in training, which I never really thought I would be when I chose to be an analyst. I kind of more imagined sort of sitting at my desk frantically coding like some kind of hacker. But I delivered training while I was a student on a product we created for GP out of hours, and I travelled over Scotland to deliver that training to health boards. It was a really odd experience as a student, because I think when you're a student, you're used to just not having the answers and sometimes just not knowing what's going on. And it was really good for my confidence to be the one with the answers and the one delivering the training and knowing what to do. And it just gives you a bit of faith in your own abilities. More recently, I've been involved in developing and delivering training for R&R Studio, because, like I said, we're moving away from SPSS and towards RStudio. SPSS has been what's been used for a long time, so we do need to train people in that. We can't just switch off overnight and be like, right, go, good luck. I've also had the chance to attend lots of conferences and events, which has been really great. I think people sometimes think because it's public sector, because it's the NHS, you don't get to do that kind of stuff. That's absolutely not true. You only have to ask. It's not guaranteed it'll get a yes, but it's worth asking. So I went to Data Summit in 2017. I was involved in a hackathon in the same year. I presented at EUROS, which is the use of artificial statistics. That's a Europe-wide conference. So I travelled to Bucharest in Hungary to present at that with a colleague. And then last year, this was obviously virtual, I presented at the NHS R conference about an R package that we created in my team. So there's just plenty of opportunities to get involved in different things that aren't strictly analytical. You just have to look for the opportunities, I guess. Yeah, next slide, please. So just to do a bit of a sort of deeper dive into the analytical side of things, because that is the main part of the job. I mentioned IRs, PQs and FOIs. All of these are actual questions that I've had to answer. And I picked these ones specifically because they stuck in my memory for various reasons. So how many people were admitted to hospital diagnosis of self-harm? That was one we had to answer quite frequently in the mental health team. It's always quite a hot topic. It tends to come from journalists because they want to write a story about this, and it's actually much harder to answer than you'd think. It's not recorded very well, because to say definitively that someone is self-harmed, you need to know their intent, and you can't always know that. Also, we're asked quite frequently how many people have been treated outside their health board in the last 10 years or however many years. That's something the government likes to keep an eye on. If you live in one health board, really you should probably be treated within that health board. There's obviously exceptional cases, but they want to keep an eye on that, what's called cross-border flow, and then maybe investigate if there's a lot of patients going from one area to another area, maybe why that's happening. The next one, how many cataract operations were performed in each health board and on how many patients? That's one I answered very early on when I graduated. It seems like an easy question. 5 analysts in my team, none of us could work out why the number of operations were nearly double the number of patients. And if anyone's interested, it's because you've got 2 eyes, so that's 2 operations, but you're still just one person. Took us a long time to figure that one out. And yeah, that one just stuck in my mind because it seems like so obvious, but it still just stumped us for a bit. And then the last one, how many people were attacked by cows last year? That was a genuine FOI that I had to answer. And we could answer it. There is actually a diagnostic code for being attacked by a cow. So all kinds of topics that might come up. Next slide, please, Caroline. So publications, these are all publications that I've worked on. The first one, acute hospital activity and NHS beds information, that was when I was in secondary care. That went out both quarterly and annually, with the annual one being a lot more in depth. There was a lot of work going into that one. It was information coming from 3 different data sets, and I think there was 4 or 5 analysts working on it at a time. Really interesting, always had a lot of interest from the government, because like I say, hospital activity and beds, they're just always interested in what's going on with that. The other 3, they're all mental health related. They were all annual. So there's mental health inpatient activity publication. That was a really interesting one to work on because we actually did move away from doing PDFs and Excel tables, and we created an R-Shiny dashboard, which is like an interactive dashboard that you can select what you're actually interested in and look at that really easily. I also used the royal we there. I did not create that dashboard. I just did some of the behind the scenes work. It was a colleague who actually made the dashboard. The other 2 are suicide publications, and those were just hugely interesting to work on. Scotland's suicide rate it's appalling. It's really bad compared to others in Europe. So there's 2 publications. One just looks at what's happened in the previous year. That one was very much anticipated this year because it was looking at the 2020 numbers. And I think there was a lot of worry that the pandemic and lockdown had impacted people's mental health so badly that we would have seen a spike in suicides, but it didn't happen, thankfully. The other one is more interesting in my opinion, because it's all very well to look back and see what's happened in the last year, but it's too late to fix anything at that point. It's already happened. You're looking at it retrospectively. The Scottish Suicide Information Database takes the cohort of people who've died by suicide over the last number of years, and it looks for similarities, it looks for patterns to try and influence policy to help people in the future. So yeah, that one's really interesting to work on, and that's the one that involves a lot of external stakeholders like the police, the Samaritans, various universities. But yeah, I can't remember exactly how many publications we produce a year. I think it's something like 400. So if you were to work as an analyst at Public Health Scotland, it'll almost certainly be part of your work. Next slide, please, Caroline. So the COVID stuff, that has formed a huge part of my work over the last year. I worked on 3 different research papers. I think COVID in prisoners hasn't been published yet, but the other 2 have. And it's looking at how COVID affects these different cohorts of people compared to the general population. It was really interesting, and it definitely influenced policy. The COVID and healthcare workers helped decide which healthcare workers got the vaccination and when, because we found that patient-facing healthcare workers, so kind of staff in A&E, places like that, were 3 times more at risk of getting COVID than just someone off the street. So they had to be prioritised for a vaccine. COVID in teachers, that also influenced policy, because we found that teachers were not at more severe risk of getting COVID than others, and that helped influence policy for the schools to be reopened. Also, the healthcare workers one I think was quoted by the CDC in the US as influencing some of their policy. So it's just been really interesting to work on. The final thing on that slide is the case control study. So to summarise it very briefly, because it's absolutely massive, for every case of COVID in Scotland, 10 people who don't have COVID are matched to that person by some characteristics that make them similar. And then they're studied to see how they differ. So, you know, did they catch COVID because of their age and sex, or was it something else? And that underpins a lot of other studies that PHS have done that I've not been involved in. Next slide, please, Caroline. So just to sum up, what I like, and dislike is too strong a word, but maybe the downsides of my job. So there's an absolutely huge variety of work. I've worked at Public Health Scotland in total for something like 6 years. I don't feel as if I've been doing the same job for 6 years. I've got to work on so many different things, and it's not all just sitting at a computer by myself coding. There's so many development and training opportunities. Going to Hungary to present, I never thought that, not Hungary, sorry, Romania. I never thought that's something I would get to do, working in the public sector for the NHS. And you only have to ask, you just need to grab the opportunities when they come up. And I've never been turned down, and that's linked to the next one. My teams have all been incredibly supportive of me trying new things. Managers have all been very, very willing to listen, even when I was the graduate fresh out of uni, of me saying, I think there's a better way to do this. And that has involved not using SPSS and using R instead. They were so willing to listen to me and let me try it. And I think from friends that work in the private sector, that's maybe not the environment there. And the last one, especially with COVID, there's such a clear link from the work to the policy. It's important to me to see that my work's actually making a difference. I don't think I would like it if I was just sort of entering figures in a spreadsheet all day and I never knew what happened to it afterwards. And I think, you know, not everyone can be a doctor or a nurse. I certainly couldn't. I don't do needles, I don't do blood, but I can still work for the NHS and help people. The downsides of it sometimes are that the data can be quite messy. When I was working on the vaccine stuff, there were people who apparently had their vaccine in 1812. Don't know what happened there, don't know how that data ended up there, but there's sometimes just data issues, but you know, they're not a showstopper, you just need to get on with it. For some people, not so much for me, it's a downside that the work isn't always super technical. You're not performing really complex statistics and machine learning and doing lots of like really weird predictive models. Don't get me wrong, some teams do that, but the day-to-day work doesn't involve a lot of that. That doesn't personally bother me. I like coding, I like problem solving, but for some people that I know, they do wish for more of that. You don't always have access to latest technology. I have friends that work in the private sector and they're like, oh, I did this really cool thing in R. And I'm like, yeah, we can't do that because we're 3 versions behind. But on the other hand, I think it forces you to be a bit creative. You need to think your way around things. It's a frustration, but for me, it's not the end of the world. And the last thing is that change can be slow. I joined in 2016 and there was rumblings of starting to use things like R, but I think only really now are we really like getting down to it and starting to focus on bringing that in. So that's 5 years. But we're a massive organisation. You can't turn around like a big cruise liner immediately. You know, you've got to take your time and do it slowly. So the change happens, it just doesn't happen overnight. But I think that's maybe my last slide. There's maybe one more that's just like a Q&A. Yeah, and that's my email if anyone wanted to send me a question afterwards if you don't want to ask during the session. But that's me, so thank you very much.